Actually, I have a few questions about the technique. You mentioned in your presentation the remote end technique. Do you are afraid that about perforation of the artery? Do you use fully catheter or catheter stone? If there's any instruments do you use for catheter technique?
You are talking about aortic?
Yes. Yes. Aortic.
Both?
Yes.
Actually, an aorta is quite big. Usually, as you see from the damage show, we're going small incision. So exactly like trying to rise the blood by lots of shape, and it's easy to separate the blood through how, about when, and sometimes you will find the blood was the occlusion dissolved, to drain it out. In difficult cases, you can use a polycaster sometimes. The problem is the distal part. Actually, the most important point to do good control first behind the extent the block to prevent any showering distance. Then try to use different size Fogarty. Try to manipulate or to mobilize the block as much as you can from up, and if you have a ring stripper, you can catch the tip of the block and try to push the ring stripper until you do complete dissection. If not, my experience, sometimes I use the Fogarty caster to push it down behind and on both sides and anterior, try to select, and by using the caster you can withdraw. But make sure you clear everything.
Okay. The second question, if you allow me, about do you have any experience about the complete occlusion in the area of popliteal artery at below the adductor hiatus until the trifurcation of the popliteal artery? Because we saw many lesions in this area. The operative surgery is difficult, and the endovascular is quite hopeless.
You mean just
yes,
behind the popliteal?
Yes, localized lesion at the adductor hiatus until the trifurcation of the popliteal artery in this area.
Usually in this area, to cut the long story short, I prefer to bypass it.
To bypass.
Actually.
Okay. Thank you very much.
You. Because it's carrying a high risk of dissection.
We got over now, that's why we're running very late. So we're going to conclude this session. Thank you very much for your attendance.
Next session is a great mission. It's about how to manage patients with thrombosis. It's about when to use and for how long to use the DWACs. Is there any rule for the low molecular way after the era of intervention of the DWACs? But before that, we will have a coffee break. Please join us in the next session at 6:10 sharp. Don't miss this session. Okay.